The Ebola virus, it's deadly, it has no cure, and it's already killed hundreds. Now the disease is spreading faster than efforts to control it. Millions of dollars are being pledged to help West African countries hardest hit. How should this money be used, and what can these countries do to contain the epidemic? This is Inside Story. Hello and welcome to another edition of Inside Story. I'm Hazem Sika. The World Health Organization announced on Monday that the death toll from Ebola has increased to 887 in Guinea, Sierra Leone, Liberia and Nigeria. This disease has reached epidemic proportions and has a real danger of spreading beyond those countries in West Africa. That's what we'll be talking about in just a moment. But here's what we know about the disease. Ebola is transmitted by direct contact with blood, bodily fluids and tissues of infected animals and people. Most people complain of having a headache, fever and a sore throat. This is followed by vomiting and diarrhea, among other symptoms. Ebola can potentially kill up to 90% of the people it infects. Health workers, family members and people in close contact with victims are at a higher risk of contracting it. There is no vaccine or treatment available at the moment. Nigerian health authorities have stepped up efforts to control the spread of the disease. Mohammed Adel reports now from Abuja.
The announcement of a second Ebola victim in Nigeria is raising fears that the 7-month-long epidemic in 3 West African nations could spread in the continent's most populous nation.
There is a second case of Ebola virus disease, and why we're able to know is because government has put in place strategy to detect cases. This is coming from one of the cases under surveillance, and that's why we're able to pick it early enough.
The first victim collapsed on arrival in the city and was put in isolation at a hospital. Had he spent even a few hours outside the airport, he might have spread his illness to more people, many of them impossible to trace in Lagos with its endless sprawl of tin roof shacks and apartments. Nigeria has strengthened its disease surveillance system to prevent and control the spread of Ebola within its borders. Passengers traveling from some countries in West Africa have been put on red alert, and public health officials have been deployed at all points of entry across the country. The government has also taken its campaign against the disease to the churches. With a knack for drawing huge crowds, authorities also see them as conducive environments for the virus to spread. Some were warned not to hold so-called healing sessions that could attract Ebola patients from outside the country. Information about the virus has also been widely broadcast on radio and television stations, as well as social media.
We've opened accounts on Twitter, on Facebook. We have a website now devoted to for information on Ebola, www.ebolaalert.org. It's functional, and what is so good about it is that it's an interactive website.
Experts, however, say rituals and traditions on handling of the dead may prove to be an obstacle in stopping the spread of Ebola.
It has been really challenging for West African countries like Sierra Leone to convince people not to really take care of the body of their relatives. It has been very challenging. 60% of infections are due to body-to-body, humans-to-humans contamination.
The epidemic has already killed almost 900 people in Sierra Leone, Guinea and Liberia. The World Health Organization says the outbreak is moving faster than efforts to control it, warning that with more infections comes a greater risk of the virus evolving into deadlier mutations. Mohammed Adel, Al Jazeera, Abuja, Nigeria.
So lots to talk about there, and joining our discussion, first of all, in Geneva, Gregory Hartl, Chief of Public Relations with the World Health Organization in London. Thank you very much for being with us. Now, first of all, just give us an assessment at the moment of how serious this threat is, because obviously your organization was saying just a few days ago that it's growing faster than the ability to control it. Just how bad are things right now?
Certainly in the three countries, and especially in Sierra Leone and Liberia, we're seeing numerous new cases each day. And so this is a serious threat. And the fact that it's so serious has led us and the presidents of the three countries concerned to announce a series of pretty extraordinary measures to try to combat this outbreak. We have asked for $100 million in funding. And you know that the World Bank has also announced that they're providing funding, and the presidents of the three countries have announced a series of extraordinary measures. And we hope that this will signal, and not just signal, but mean the turning of the tide on the ground. We need a lot more bodies on the ground, maybe hundreds of specialized health workers and other public health specialists.
One of the requirements for limiting the spread of Ebola is that those who've contracted the virus and the medical personnel as well treating them need to be kept under strict quarantine. That's easier said than done, isn't it? Particularly in some of the countries that you mentioned where resources are limited and the public health protocols and warnings are often not heeded.
Well, one of the big challenges of this outbreak is the fact that this comes in three countries which relatively recently went through conflict and where the health infrastructure was in many instances destroyed, and there isn't a lot of health infrastructure in some places. So we're having really to start from scratch. And as you say, what we need to do, it's well known how to control an Ebola outbreak. What needs to be done, though, is more difficult when there is the lack of infrastructure there, and also the lack of the understanding on the part of the local community as to what we need their help with. Because if we can identify cases and all their probable contacts and follow them for 21 days and isolate them properly and protect the healthcare workers properly who are looking after confirmed or potential cases, this is something which we eventually can stop and bring to an end. But it is very difficult under the circumstances which exist in the three countries.
And as I understand it, a patient may not get symptoms of the virus until 3 weeks after getting infected in many cases. How much of a challenge is that for trying to contain the spread of the virus?
Yes, well, certainly what you need to do, as you say, is a challenge is tracing and keeping in contact